Hi, my name is Dr. Mohamed Zehran and I'm a consultant medical oncologist at the Apollo Cancer Center in Chennai. I'll spend the next few minutes raising awareness about lung cancer. As you know, cancers are on the rise globally and the same is in India as well. Lung cancer is no exception. So what I'll do is I'll briefly talk about the symptoms of lung cancer, the causes of lung cancer, how we go about diagnosing lung cancer, and the various treatment options that are available. Now, the symptoms of lung cancer may be because of the actual primary cancer itself in the lung, or they can be more non-specific symptoms. So what are the symptoms that are related to the actual primary tumor in the lung? Well, people can complain of cough, not a cough that most of us have, which tends to settle down without any intervention whatsoever. I'm talking about a cough that is persistent, a cough that continues to get worse, and a cough that does not respond to the basic medical treatment that your general physicians offer you. People can sometimes also present with blood-stained cough, where they cough up blood, and this can be an alarming sign as well. Occasionally people can present with breathlessness, so the distances that they could cover quite freely, they feel a bit of restriction when they do those kind of distances, and sometimes people even feel breathless just walking around their houses. People have noticed a change in their voice, the voice becoming quite hoarse, and chest pain can also be one of the presenting features of lung cancers. There are some non-specific features of lung cancer also, like for example extreme tiredness and fatigue, and occasionally weight loss. Whilst all of these symptoms that I've just talked about can be caused by a lot of other things other than lung cancer, and more often than not they tend to be because of less worrying problems, like for example infections, inflammations, and so on, we've got to be aware that these symptoms can be the initial sign of lung cancer. So if you have any of these symptoms, please do seek urgent medical attention. Now we'll talk about the causes of lung cancer. The most established causes of lung cancer include tobacco smoking, and that could be cigarette smoking and smoking of BDs in various parts of India. Occasionally people inhale tobacco and snuff tobacco, which is also a risk factor. Secondhand smoking or passive smoking can also be attributed to causing a rise in the risk of lung cancer, and so can air pollution. Now, the relatively newer concept of this e-cigarettes or electronic cigarettes seems to be quite spoken about, and we see a lot of youngsters using these products. Now, whereas there is no obvious link between e-cigarettes and lung cancer, there is a growing body of evidence that e-cigarettes can cause harm to the lungs. Well, it is a new concept, so perhaps in a few years' time we will know if these products also lead to lung cancer or not. And occasionally a family history of lung cancer can also be a risk factor. Now, how do we go about diagnosing lung cancer? Well, the first test that we do tends to be a chest x-ray. So I've described the symptoms that people can present when they may have lung cancer, and the first thing the doctor might want to do is a chest x-ray. Now, not all lung cancers are picked up on a chest x-ray, so if one has these symptoms ongoing and they still have a normal chest x-ray, then we move on to a CT scan. A CT scan is a bit more accurate, and we can look at the more finer details of not only the lungs, the windpipe, the airways, etc., to make sure we don't miss a small tumor which may be not so obvious on the x-ray. And once we know that there is a suspicion of a tumor or a cancer in the lung, then the next obvious step is to confirm this cancer, which is with a biopsy. And a biopsy is nothing but taking a small sample from this tumor to make sure that we confirm that this is a cancer, because we can never tell anybody that they've got lung cancer until we have taken a sample and we have diagnosed with a biopsy. So now we've got a diagnosis of lung cancer on an x-ray or a CT, we've confirmed that with a biopsy. The next question that we ask ourselves is, what is the stage of this cancer? Because all treatments depend on the stage of the lung cancer. And the way to stage the lung cancer is with a whole body scan called a PET-CT scan, which is used quite readily nowadays. In some instances, we just do a CT scan of the chest, abdomen and pelvis. But a PET-CT scan is a whole body scan, which not only shows how active this cancer is, but also gives us an idea of where all this cancer has spread. In other words, we get to know if this is an early lung cancer or if this is an advanced lung cancer or a stage 4 lung cancer. So now that we've made a diagnosis of lung cancer, what are the treatment options that are available? And the first thing I want to tell you is that even a decade or so ago, the options for treatment of lung cancer used to be quite limited. Now, over the last 10 years or so, there's been significant progress that's been made in the lung cancer field. So, if the cancer is picked up at an early stage, then the best treatment, where appropriate, tends to be to take the cancer out with surgery. And that could mean either taking part of the lung out or the whole of the lung where it's appropriate to do so. And to be able to think of a cure for lung cancer, surgery is perhaps the best means to be able to do that. In situations where surgery is not feasible or not appropriate, then we think of the other treatment modalities, which could include radiation, chemotherapy, immunotherapy, and targeted therapy. And I'm sure you've heard of these terminologies. Let me briefly tell you about what these terminologies actually mean. Chemotherapy is nothing but a chemical which is given either via a drip or in the form of tablets to try and destroy these cancer cells. Immunotherapy, on the other hand, is a treatment which enhances the body's own immune system to try and deal with the cancer cells and damage these cancer cells. Targeted treatment, on the other hand, is a way of finding out with technology how we can specifically target these cancer cells at the very mutational level. And there's been significant progress that's been made in the targeted therapy area in the last few years, to the point that more and more people who are diagnosed even with advanced stage 4 lung cancers are living longer and longer these days. I want to briefly mention about radiation as well. Radiation is nothing but using high-dose X-rays to damage the cancer cells. Sometimes it is used on its own, at times it is used in combination with chemotherapy drugs. Now that I've talked about treatments, I do want to also mention the concept of palliative care in lung cancer. Unfortunately, we do come across situations where an elderly person is diagnosed with lung cancer, which may also be quite advanced, where there is the pressure on clinicians and family to be able to offer some treatment or another. What I want people to know is that can be offered something called palliative care or comfort care, and in people where they're frail and where any of these treatments that I've just outlined are not appropriate, where we feel that these treatments might cause them more harm than good, then we would recommend palliative care, which is nothing but trying to maintain people's dignity, control their pain, and allow them to be in the comfort of their own homes around their loved ones. To discuss these with your clinician. A diagnosis of advanced lung cancer doesn't automatically mean that you have to have treatment. Well, of course you will have treatment if you're strong and well enough for it, but if you're not well enough for it, or your loved ones are not well enough for it and not capable of handling the tough treatments, then supportive care is quite a reasonable option. Thank you.